This is dressing
and
undressing a resident.
With a affected side, weak side, in this scenario, we're going to say that the left side is affected, right? Due to a stroke or some other reason.
Okay. Not before entering the room, identify and greet the resident.
Hello, Mr. Johnson. My name is Chastity. I'm your nurse aide, and I'm here to get you dressed for the day. Okay?
Explain procedure.
Check. I'm going to identify my resident. Can you tell me your name and date of birth? Great.
Provide for privacy, gather supplies, perform hand hygiene.
I have day clothes, shirt, and some pants, and I also have a
Bath blanket.
bath blanket. Raise my side rails. Every skill in the raise your side rails for safety. And raise the bed to the best level for body mechanics. Note all criticals for me, okay, Maddie? Alright. Mr. Johnson, I'm just gonna put this down while I'm working at your bedside, okay? Are you ready to get dressed? Here you have company coming today.
Don clothes if clothing is soiled.
So if the linens were soiled with urine or any other bodily fluids, I would don gloves, okay?
Cover the resident with a bath blanket or top sheet and remove top linens.
I'm gonna keep you warm and cozy here. I'm just gonna put this bath blanket on me. Alright, Mr. Johnson, I'm just gonna work your linens in here. Affected side again is the left side. Take from the strong, give to the weak. Take from the strong, give to the weak.
This one's a critical. Remove gown from strong side first and place gown in designated soiled linen container.
Alright, I'm gonna put my hands underneath his shoulders and raise him up. And I'm going to untie his gown in the back. And my critical states, say it again, Maddie.
Remove gown from strong side first.
Okay,
And
so
place it
this
in
is my
soiled
strong
linens.
side, the right side. Take from the strong. And then I'm gonna take it off the affected side, the left side, or also what we call the weak side, okay? Again, I'm not exposing him. I'm taking this off, turning it away from me, away from my clothes, and I'm putting it into the hand.
Remove gloves if worn.
If I wore gloves at this point, pinching, taking off, wadding it up, going underneath, pulling it out, dropping my gloves into the trash can.
This one's a critical. When dressing the resident in a button-up shirt, always dress from the affected weak side first.
Alright, so take from the strong, we're putting on, so we're going to give to the weak, right? And the weak side is this side, the left side. So, I am going to, I like to just kinda work my linen, or not linen, my clothing like this, especially if it's a long sleeve. I'm just gonna kinda pull this, like it would go. And then I'm gonna take the sides, take the rest of this and kinda fold it underneath of him. Okay. Mr. Johnson, I'm gonna have you to roll, okay, on the count of three, and I'm gonna roll you over. 1, 2, 3. You're gonna pull it through. And then I'm going to put it on the strong side. And some of these mannequins do better with dressing than others, like he's got quite a bit of mobility and movement. Some of them don't have as much. Now you're gonna button it. Are you comfortable? Does that feel okay?
This is a critical too. When dressing the resident in pants, always dress the affected weak side leg first.
Okay, so we have a pair of shorts. we are going to give to the weak, right? Give to
Assist the
weak.
resident to raise her or his buttocks
If
or
they
turn the
can,
resident from side to side.
If they can, we can have them to, put their heels into the bed and to raise up. We can put, like, they can push with this foot that's not affected and I can slide it over. Or our mannequins, we're probably going to have to just put it on them. So again, I like to just kinda bunch it up, put it over the weak side, give to the weak. So give to the affected side. Can't go too far up because you also gotta get it on, be able to pull pants up, you have to be able to start down here, so I'm gonna go ahead and also put it on this side. But I started on this side, the weak side. So pull it up, pull this up. Now, I need to turn him towards me because I'm still giving to the weak. Mr. Johnson, I'm gonna row you towards me on the count of 3. 1, 2, 3. And I am going to pull the garment up over the weak side. One more row. I know this is getting tiresome. And then you pull it up over this side. I'm gonna roll him over, and what am I gonna do with all the buttons and the snaps and zips in the front? Make sure that everything's adjusted right, it's not tugging or wrapped around them.
Okay, put on the resident's socks, draw the socks up the resident's foot until they are smooth.
Now, on the socks, it doesn't matter which side, okay, you can do either or. He already had socks on, so I'm gonna take them off and put them back on. So for socks, he has a affected side. I'm gonna give to the weak, I'm just gonna follow order, okay, and I'm gonna give to the weak. So I'm gonna put that one on, and then I'm gonna put the right side, which is unaffected, the strong side. And you're gonna pull them up. It definitely would be a safety issue for someone who has an affected side that they have these type of socks, right, gripper socks.
Leaves the resident comfortably dressed, and this is a critical, leaves the resident in a position of safety and comfort. Place call light within easy reach of the unaffected side.
I'm gonna go ahead and take off my bath blanket. Turning it away from me, dropping, I keep looking for it down here, it's over here. Alright. I'm gonna straighten up his linens always. Make sure he can wiggle his feet down here. Are you comfortable, Mr. Johnson? I think your family's supposed to be here about 10 a.m., okay? Your show's coming on soon, I'll turn your TV on for you. Make sure that their bedside table's within reach, they have water, they have a drinking cup, tissues, anything else that they need. My rails are down. My call light is within reach, which is a critical, and you need to put it on the unaffected side. So, in this scenario, it's over here on his affected side. I'm just gonna take my call light, and I am going to ensure that it is over here. It should have a clip on it, and I would clip it onto the linen, onto the bottom sheet. Remember, don't clip it on here, because if the blanket comes off, then it's gonna be in the floor, alright? So you're gonna see at the at the facility that we go to Monday, they will have clips where it clips to their linen. To the bottom sheet, not just the linen.
Critical, performs hand hygiene, record and report.
Alright, wash my hands, record and report.